Good afternoon, everyone. My topic is the role of mobile endoscope in dacryology. As we know, dacryology is science that deals with the lacrimal system of the human body. Lacrimal system incorporates both ophthalmic and nasal system. Ophthalmic part consists whole lacrimal system except NLD. Nasal part consists nasolacrimal duct. So we have to successful management of the any case of the epiphora, we have to rule out the nasal pathology like nasal polyps, nasal synechia, DNS, या hypertrophied middle turbinate. To rule out the nasal pathology, what we are doing now in the traditionally we are doing in the OPD nasal speculum examination. But limitation with the nasal speculum examination is the restricted field of view. Up to anterior nares we can only examine and not able to document your counseling to the patient. We can't save the pictures and cannot show the pictures to the patient and attendants. Then we are taking, if we are not able to do in the OPD, then we are taking patient to the OT and doing the traditional nasal endoscopy. But here is also limitation. Limitation is this system is the non-portable. Here LED system and endoscope, it can't port anywhere. And another thing is it is expensive compared to our mobile endoscope. So that we come for the mobile endoscope, which is now usually used as the otoscope in the market. This is the pin-like LED mounted camera, which is attached by the mobile through the USB port. You can attach it to the mobile computer. You can save the video, you can save the image, you can document it, you counsel the patient and attendant also. And it has the benefits, it has the wide range of view, it is able to document, it is portable, pocket friendly, and it is very cheap. And so our purpose, so then we have tried to find out the usefulness of this endoscope in dacryology for diagnostic and therapeutic purpose. So that we have done the observational study in our institute with the patient of the symptomatic epiphora. Then we have divided the patient into the two parts, diagnostic purpose and therapeutic purpose. Diagnostic purpose, we have selected 31 patients. Among the 31, 18 is the female, 13 is the male. And out of that, 25 examines in the OPD and 8 examines in the OT. Average age is the 52 years. And after that, second part is the therapeutic purpose. We have taken the patient of the failed DCR and CNLDO for the examination. Number of all these patients are 8. Among them, 5 is the female and 3 is the male. And out of that, 4% of the CNLD or 4% of the failed DCR. This is the short video, how we are examining in the OPD. We are doing mobile endoscopy in our OPD. Prior to endoscopy, we put the Xylocaine nasal spray and then we do the endoscopy by the mobile endoscope. We put the mobile holders and attach the USB port to our mobile and examining up to the middle turbinate. We are not able to examining the superior turbinate because this is the limitation of this scope. We are not able to go to the inner side because its handpiece is short. Handpiece is not very long, so we can't able to go to the upside. And its image quality is little bit down compared to the traditional endoscope. And what is the result? Diagnostic purpose, we get the result. 20 cases is within the normal limit, 5 cases is roomy nose, 8 cases is the DNS. All DNS cases we are, OT screening we have done, and out of that 2 cases nasal synechia, 3 cases are severe DNS, and 3 cases we are not able to do. And the result side, therapeutic purpose, failed DCR, 1 cases we are able to manage by the mobile endoscope, 3 cases I have managed by the traditional endoscope. And for CNLDO, 2 patients we are able to see the probe and 2 patients we are not able to see by the mobile endoscope. Then conclusion. Conclusion is divided into pro and cons part. First of all, important is cost effective so that every ophthalmologist can try to do learn the endoscopy. Second one is the portable, even can do the nasal screening in the remote campaigns, and it is better alternative other traumatic traditional nasal endoscope for screening and pre-op examination. Cons is its image quality is not good as the traditional endoscope. it is limited use of the therapeutic purpose and need to do more observational study by different hands to understand its usefulness in dacryology. Thank you.
Other than the cones you have mentioned, what other limitations this procedure has got?
Limitation
Compared to ophthalmic DCR or external DCR.
External DCR, this is not, we are talking about the external
What are the
DCR.
limitation of the procedure you have highlighted?
Yeah, this is, arm is very short, sir.
No, I am asking for clinical limitations.
Clinical limitation.
Yes.
Yeah,
It is of no use in punctum strictures. It is of no use in canalicular blockage.
No, sir. We have shown the nasal evaluation. We are going to nasal evaluate every case of the DCR.
So first you will refer the case to your ENT.
No.
You will do it yourself.
Yeah.
Okay.
So this is the helpful for everyone.
My issue is that in the few number of cases that you showed 50% were normal, your examination, and you had deviated nasal septum.
Yes, sir.
Now, deviated nasal septum, you don't need a modified otoscope to see. I mean, you just put a 30-cum speculum and you can see the deviated nasal septum.
Deviated is we put the speculum and we do the screening in the OT, sir.
No, even in the OPD, if you just put a 30-cum nasal speculum
yes,
and put a torch, you can see a
we
DNS.
can see,
Yeah.
but not able to document your counseling, put the image in the archive for the patient and others. They are always
For
telling that
documentation,
this is yes, sir.
Okay,
for
fine.
the documentation is very important.
Thank you.
If any problem, we can show to the patients. This is the DNS. We are just retract by the speculum, and then we are able to see your inner side. Your nose passage is very narrow. We put the video in the archive, and if any problem, we can show to the attendants and patients.
Do you get a X-ray PNS done? X-ray PNS done as a preoperative, for evaluation?
X-ray PNS not every case.
It is not required. I hope you keep attending ENT annual conferences also. Thank you.
Thank you, sir. Thank you.